Hi everyone, welcome back to iMumz Ask Me Anything session. So today we are back with some diet tips for you. So we have a very senior gynecologist, a very experienced one, Dr. Anushree Pande. She's a fertility expert, and she's that new age gynecologist offering the most effective and latest treatments for you all. So she has been trained in high risk pregnancy and a lot of infertility issues, and she believes in giving the best to the patients. So I believe you will be able to get the best of her today. All over to you, ma'am.
Okay. Good evening, everyone. How are you all? I'm sure this is a COVID crisis time, and I truly believe that all pregnant mothers out there have a lot of questions regarding how things are going in these worryful times. So, today, the topic of discussion is some diet tips in pregnancy. So let me start that a healthy pregnancy diet is important for both the mother and the baby, because whatever a woman eats and drinks during pregnancy is her baby's main source of nourishment. So according to ACOG guidelines, the most important 5 tips that I would like to give to every pregnant woman is consult your doctor as soon as you get pregnant, because they are going to tell you about something or the other which is very important that you don't know of. The first important thing is the intake of a prenatal vitamin as soon as you get pregnant or even preconception. That is intake of folic acid. Now, folic acid is a vitamin which prevents birth defects in the child, that is, neural tube defects in the child. So, it's very important that from a very starting, you start taking folic acid, because normal vegetarian people, who the sources of folic acid are less. It is from animal source mostly. Therefore, it's a very inexpensive tablet that you should start taking. So first and foremost is the intake of folic acid. Secondly, I would say you have to maintain hydration. Initially, first trimester of pregnancy, when you have a lot of morning sickness, you don't feel like eating anything. But at least in these summer times, it's very important that every 2 hours, you take something. It can be juices, charge, buttermilk, or even infused water. You can put some citrus fruit, cut them, and then put water in it and drink it throughout the day. Maybe 3 liters or 4 liters of water is very essential. Coming to the next diet tip that I would want to give is intake of green leafy vegetables in the diet, because the iron levels, they reduce in pregnancy. The child needs more of iron because the blood supply, the oxygen has to go to the baby. So you have to start taking iron tablets. So consult your gynecologist regarding that and start taking iron tablets till the end of term of pregnancy. The fourth important is taking of calcium. उसी से iron और calcium का requirement fulfill हो जाएगा. We don't require supplements of iron and calcium, but that is not true. Apart from the dietary sources of calcium, we also have to take supplements of calcium, because the requirement of calcium increases in pregnancy. And so we need to take supplements of calcium also, apart from the dietary sources. Like regular intake of milk is very essential. Next, I would want to say that there is always a myth that eat for two, eat for two. That is not true. We do not have to eat for two people. We have to have a healthy, nutritious meal, a normal Indian diet. It comprises of everything, that is carbohydrates in the form of roti, chapati, rice, 2 katoris of dal you can have, 1 katori of vegetable, curd, and salad. This is a healthy, wholesome food. So intake of this is as enough. You don't have to eat for two. Definitely, when you are in your second
Ma'am,
trimester.
sorry to interrupt. There was a little bit of network issue in between. I think it's fine now.
Okay. So should
Yeah,
I
probably
repeat?
you can just recap point 3, 4, and 5 for them.
Okay. So the point 3 was intake of green leafy vegetables and also the intake of supplements of iron, because sometimes the dietary intake does not suffice the supplements. So it is very essential that you also take iron tablets till term of pregnancy. The fourth, I emphasized on intake of dietary sources of calcium, जैसे milk, yogurt, low fat milk can also be taken. Apart from that, supplements of calcium is also very essential. So you have to take iron and calcium along with folic acid throughout your pregnancy. This is what was the fourth point. And I also emphasized on eating wholesome food, that is, having carbohydrates, protein, and fats all together. Chapati, rice, a katori of dal, vegetable, salad, and yogurt. So that is very important. Then limit the intake of caffeine in your diet, avoid alcohol, and of course, avoid smoking. Then do not eat undercooked meat. There are a lot of people, when they go for any complimentary breakfast in a restaurant or somewhere, then they prefer taking cold cuts. So that should be avoided. Then uncooked meat should be avoided. I think that's about it. If any questions you have, you can definitely ask me.
Uh, Thank you so much, ma'am. A lot of questions, so I will take them one by one.
Okay.
One second. Yes. Uh, Ma'am, Veena is saying I'm trying to get pregnant, but I'm overweight. How to reduce my weight?
Okay, that's a very good question. So, obesity plays a very important role while you are conceiving. So, you have to have a good basal metabolic rate, and your BMI should be proper within 25. And in order to reduce weight, proper diet and exercise is very important. So, a diet which has a low glycemic index, for example, a low carb diet, should be introduced. Secondly, exercise. Exercise plays a very, very important role. You can watch any YouTube channel for exercise during these times when you want to conceive, because you cannot go to a gym, or maybe you cannot go outside. But exercise and diet both contribute in reducing weight and reducing your obesity, and only then you will be able to conceive.
Thank you, ma'am. Ma'am, स्नेहा is saying मुझे बहुत एसिडिटी होती है, कुछ भी खा नहीं पाती हूँ, मैं क्या करूँ?
So, acidity is common in pregnancy. Try and avoid spicy food. Don't eat a lot of chilies while you are pregnant, because that increases the acidity. Also, cold milk at night maybe may suffice the acidity problem. So don't take three major meals. Instead, take small portions. Take 6 meals in a day. So you won't be empty stomach for a longer period of time, and you can reduce acidity. Take small portions. Every 2 hours, maybe you can have small meals, and avoid spicy food.
Thank you, ma'am. Ma'am, Mamoni is 26 weeks pregnant. She wants to know, can we eat non-veg food during pregnancy?
Of course, of course. There is no harm in taking non-veg food. The only uh, uh, the only thing that you cannot eat is uncooked food, raw meat, cold cuts, processed non-vegetarian food, and also there are some people who like fish. So any fish like a shellfish which contains mercury should be avoided. Apart from that, if you want to eat lamb or chicken, definitely, it's a go. You can have non-veg.
Thank you, ma'am. Ma'am, there are a few people who have diabetes, so they are asking, is there any particular dietary instructions that you would like to give them?
So, diabetes is a condition which predisposes to a lot of problems, especially in pregnancy. Like it can cause preterm labor, it can cause small babies, it can cause intrauterine death in the baby, it can cause big size babies as well. So, diabetes has a lot of problems in pregnancy, and therefore the diet of a pregnant woman should be of a low glycemic index. By low glycemic index, I mean she should take carbohydrates which have low glycemic index. Avoid pasta, rice, or whole wheat. Rather, you can take complex carbohydrates in the form of oats, in the form of quinoa, these are complex carbohydrates. They have low glycemic index. So in your regular dietary meals, avoid potatoes, rice, a lot of oily and fried food, and incorporate more of green leafy vegetables, protein in the form of paneer, and in the form of carbohydrates, try and incorporate low glycemic index food, like as I told you about oats and cereals which are fortified with iron, and avoid pasta, white bread, and all those things. So that's how you can maintain your weight in diabetes.
Thank you so much, ma'am. Ma'am, just a little off topic, but Nidhi is 4 weeks pregnant. She's saying, can you tell me how to handle urine infection? I'm in my first trimester.
So, urine infection is very common in the first trimester of pregnancy. In order to avoid urine infection in pregnancy, you have to have plenty of fluids, as I previously mentioned. At least 3 to 4 liters of fluid is very, very important to take, that you should take. And that's how, like, also abstinence is recommended. And you can take an alkalizer if you feel like.
Thank you, ma'am. Ma'am, Jyotsna is saying, hi, I tested positive for COVID. What kind of diet should I follow to recover best? Also, my hemoglobin levels are low despite iron supplement. How can I supplement for it?
If your hemoglobin levels are low despite iron supplements, contact your gynecologist. She might try and able to find out the actual cause of anemia, the less hemoglobin. Maybe it's not iron, maybe it is something else, and she might supplement you with other things, and she might actually try and able to diagnose first. Second, you asked me that COVID in pregnancy have been positive. So, are you in the recovery phase as of now? And if yes, and it was a mild COVID, then as it is advised in any COVID situation, the diet has to be nutritious. So, wholesome food. You don't have to skip anything. Wholesome food. Dal, roti, sabzi, raita, everything should be there in your diet. Take more of citrus fruits. Like we say, vitamin C rich food is very important. And zinc. You can say oral supplementation of zinc can be done.
Thank you so much, ma'am. Ma'am, Ankita is asking, I'm taking Folsafe. Is this fine? FOLSAFE.
Of course, yes. Folic acid by the name of Folsafe is perfectly fine. That's the trade name. But you have to take folic acid. It's very important to take folic acid.
Thank you, ma'am.
Even in patients who are planning to conceive, like they are just planning. So 3 months before, they should start taking folic acid. A lot of girls, they don't know it's their first baby and they are planning pregnancy. They should contact their gynecologist, talk to them, and they might start you on folic acid regularly for 3 months.
Thank you so much, ma'am. Ma'am, Shravya is saying, I had my C-section 40 days ago. Still, I have a lot of pain. And how to reduce my belly fat? Like, what do I need to eat?
Now, that's a very nice question. How to reduce belly fat? Well, we recommend that any patient who has undergone a cesarean section should start exercising 3 months after the cesarean section. Apart from diet, since it's been almost 40 days, you can definitely take normal Indian meal that you can, I am not expecting you to start dieting because you must be breastfeeding the baby. So, this is not the right time to focus on diet concept. But yes, post 3 months, you can start some exercising, some abdominal exercises, and that might help you in reducing the belly fat. And apart from diet, you can maybe reduce some calories. That's it. Reduce some caloric deficit in your diet. That's it.
Thank you so much, ma'am. Ma'am, Lobana is in the 4th month of pregnancy, and because of summer season, I'm getting a lot of acidity and don't feel like eating anything. Only curd rice and fruits feel good, but they won't give all the nutrients, right? Any suggestions from you?
Can you start on protein powders? I'm sure your doctor must have recommended you. Protein powder are supposed to be taken. It can be taken with cold milk. It can be taken with warm milk. So maybe that might help you. you are already taking fruits, yogurt. You can take fortified cereals if you can, like for example, cornflakes or muesli with milk, and you can take protein powders.
Thank you so much, ma'am. Ma'am, I see there are a couple of questions more asking for dietary tips for COVID positive patients. What would you like to suggest for them?
So I would always say that, vitamin C, like citrus fruits, all types of fruits available. You should take all types of fruits because the immune system is greatly affected in COVID and also in pregnancy. Pregnancy in itself is a reduced immunity state, so you are more exposed to infections. So, if you are COVID positive in pregnancy, then you need to take specific care about your diet. You cannot skip any meal. In spite of the fact that you're feeling that you don't want to eat, you have to eat. Maybe you don't have taste, you don't have smell, but you have to have your food properly. Drinking milk, taking vitamin C supplements, taking zinc supplements, it's very essential. And also iron and calcium, which is generally advised in pregnancy. So, and keep yourself hydrated.
Absolutely. Thank you so much, ma'am. Ma'am, Payal has two queries. She says, how to cope with gastric issues, like what should I eat to cope up with it? And my hemoglobin levels are very low, 8.6. My ferritin level is good, however. Diagnosed with beta thalassemia. Please suggest what I should have.
I think you should talk to your doctor regarding the same because you have been diagnosed with beta thalassemia. I think blood transfusion should be advised to you because your hemoglobin is 8.6. Apart from the normal diet supplements that you must be taking already.
Thank you, ma'am. Ma'am, you mentioned milk a couple of times. So, Minakshi is 7 weeks pregnant. She says, please suggest a replacement for milk. As soon as I take milk, I immediately vomit. So, I think
Why
I
don't you
also
take
fall into her
yogurt or
category.
yeah, that's a good question. There are a lot of people they don't want to drink milk, so maybe if you want to take yogurt, it has lactobacilli. It's a probiotic and also calcium. So you can take yogurt. You can take any smoothie. Strawberries are available. You can put some curd and strawberries and sugar, and then make a nice smoothie out of it. You can take a smoothie. Makhanas are rich in calcium. You can take makhanas in your snack time. So that's about it. Even kale and spinach, kale and bok choy, if you know of, they are very rich in calcium. So you can take them. And पनीर I'm sure पनीर से नहीं होता होगा, दूध से अगर होता है. So पनीर, a good source of protein. Plus you can take paneer, any dairy product like that, if not milk.
Thank you so much, ma'am. I think you've already answered this. Varna Shri is asking, I'm in the 6th month now. In the last visit, I found out that I have gestational diabetes and the reading was 240. So, is there any way to reduce it with diet, or should she just start insulin or some medication?
You should be put on insulin apart from diet. And you have to monitor your blood sugar levels, and you have to contact your healthcare professional about your blood sugar levels. And the diet, definitely, as I have already mentioned about the low glycemic index diet, that you have to keep following.
Thank you so much, ma'am. Ma'am, Swati is saying after dinner she feels some kind of acidity usually. So, is there any specific instruction to avoid that
Yes,
in the
so
night?
early dinner is expected. For example, make when if you're having 6 meals in a day, make sure that you finish off your last meal by 8 o'clock, so that you have ample amount of time to move around before you go off to sleep. And I think that might help you. Also, a glass of cold milk might suffice.
Thank you so much, ma'am. Ma'am, you mentioned low glycemic index diet. So, Garima in those lines has said, I'm already in a high protein diet,
Yeah.
and her glucose level is 155 after 2 hours.
Mm-hmm.
So, which food should I avoid more? And she's in the 35th week of pregnancy, so she's already on a protein rich diet.
Avoid sugars, I would say. Like, don't take it, if you have cravings for sugar, avoid that. Don't take a lot of fruits like banana or mango, which are rich, like high in sugar. Then, thirdly, as I told you about the low glycemic food, so reduce the intake of chapati and rice, and maybe take more of fortified food and something which like oats or maybe dalia, like that.
Thank you so
155
much.
is pretty close to normal. Yeah.
Okay. Okay.
So she can be managed on diet.
Yeah, I think she's already managing it well. Seems
Yes,
to be
she's managing
managing
it
it.
well. Yeah.
Ma'am, Mansi is saying, please suggest how to improve immunity during these COVID times.
As I told you, like, you cannot skip your meals. You have to have your food properly. You have to take your prenatal vitamins and add supplements of vitamin C and zinc also to your diet. And take healthy food. Don't eat junk, don't go out, and don't eat a lot of spicy food, because this is not the time when actually you can consult for small things to your doctor. So you have to make sure that you keep yourself safe and healthy at home by taking nutritious food which is homemade, and your cravings for outside food is not much.
Thank you, ma'am. Ma'am, Nutan is saying, I have increased uterine arterial resistance. What should I do, ma'am? I have just completed my fifth month.
Then you have to talk to your doctor about the details about it. Just on uterine arterial resistance, I can just say that maybe the blood supply to the baby is getting affected. You have to talk to your gynecologist about it.
Thank you, ma'am. Ma'am, you mentioned BMI, so Khushbu has a query here. I'm 35 weeks pregnant and gained approximately 15 kgs till date. My BMI is 32.8 right now. Is this concerning?
Yeah, definitely. Since your BMI is more than 30, you come in the obese category. So, preferably when you come in the obese category, the recommended weight gain is 5 to 9.1 kilograms during the whole pregnancy. So, 15 kg of weight gain is more as compared to what is recommended. So, you have to take care that now, since you are in the end of the trimester, please try not to have a lot of food which is like ghee and all those stuff. Take regular nutritious food, regular healthy meal. Don't try to increase your weight more. You have already crossed the barrier.
Thank you so much, ma'am. I think I see a query here that would be relevant to many of the pregnant ladies. So Riddhi is saying, ma'am, how many glasses of water should I be taking? In the night, I feel the urge to pee and then I feel thirsty also. But in the whole night, I can't sleep because I have the urge to pee and then drink water and then the cycle continues. How to
So रात को
get
at night you can have good amount of water before sleeping, and then in the morning you can have, I think that would then, and throughout the day, like maybe every 2 hours have a glass of water or maybe two glasses of water. You can also prefer taking infused water, as I previously told, because sometimes you get bored of the normal water that you are having. So you can put some slices of quinoa or orange, some mint, some ginger, which also helps in avoiding morning sickness, and take throughout the day.
Thank you, ma'am. Ma'am, somebody here is asking, what is the best dry fruit for second and third trimester?
As such, I always recommend maybe 3 to 4 almonds and 2 walnuts in the morning. That's about it. Not a lot of dry fruits, I would recommend, because post delivery you anyways have a lot of dry fruits.
Yes, I think that's very helpful. Ma'am,
Yeah.
Mansi is saying, how can I
Seeds and
increase
nuts,
my...
I would always say, I have to intervene.
Okay.
Seeds and nuts are very necessary. They have omega 3 fatty acids. So, maybe just a fist, you can have seeds, pumpkin seeds, and all those types of nuts.
Thank you, ma'am. Ma'am, Mansi is 22 weeks pregnant. She's saying, how do I increase my protein intake without the protein powder? Can 2 eggs per day be sufficient for my protein intake?
Of course. So if you don't want to have protein powder, maybe you find it too sugary and you don't like it, it's not necessary that you only have to take protein powder. You can have regular sources of protein in the form of non-veg if you have chicken. If vegetarian, then you can have paneer. You can just buy, for example, half a kg of paneer from the market, divided into 5 portions. That makes it 100 grams each. So make sure that you are having 100 grams of paneer every day in any format. You can make a paneer bhurji, you can make a paneer salad or a paneer sandwich. So that ways, your protein intake is taken care of. You can have soya nuggets. You can also have good 1 or 2 katori of dal in the afternoon and maybe paneer and eggs in the evening. So you won't even get bored. Sometimes there are a lot of people, they can boil black chanas and then make a salad out of it and eat that.
Thank you, ma'am. I think a lot of variety to choose from. Monica is saying, I'm 15 weeks pregnant. Can I take the COVID vaccination?
Yeah, that's a big good question. Recently, only we had a good discussion about COVID vaccine and pregnancy. So, as far as Government of Indian guidelines, ICMR and CDC recommendations, we are having only AstraZeneca, Covishield, and Bharat uh, Covaxin, which are not recommended by the Indian government presently to pregnant women. Though the UK guidelines are saying that you can take the vaccine, but they are Pfizer and Moderna, which are not available here. So, until proper guidelines and recommendations are there, we as gynecologists and obstetricians cannot tell you that you can take COVID vaccine in pregnancy.
Thank you, ma'am. I think a very relevant question in these times. Ma'am, Payal is saying, I'm 27 weeks pregnant and my TSH is 3.4. Is there a way to normalize the level with my diet?
Not really, but you are still pretty close to the normal range. Up till 3 in third trimester is fine. So I'm sure that you are not on any medication right now.
Yes, I think she has not mentioned it yet. Ma'am Gaurav says, my wife is expecting twins, but is finding too much nausea throughout the day. She can't eat properly. So can she take protein powder or something?
So twins, that is multiple pregnancy, has
Yes, at eight
nausea.
weeks.
Yes, so nausea is very common and rather more in twin pregnancy because, of course, the HCG levels are more in a twin pregnant female. And I am sure that she must be going through a bad time because it's really very bad. So, there are a few points that I recommend to even normal pregnant women. Maybe she can opt for that. First of all, is early morning, a rich carbohydrate diet. For example, when you are just getting up, keep a box of rusk or toast, that is wheat toast or rusk, which is available by your side, and immediately take that reduces the nausea of empty stomach that we call morning sickness. Secondly, every 2 hours have something. There is a notion that don't eat anything, I can't eat. No, the more you keep your stomach empty, the more that nauseous sensation would be there. So every 2 hours, take something, like sometimes you can take a citrus juice, you can take fruits, you can take small snacks. This is how you can compensate the daily dietary part. And ginger is a good antiemetic, so you can have infused water with some ginger apart from the medication that might have been prescribed to you by the doctor.
Thank you so much, ma'am. Ma'am, Pallavi is 13 weeks pregnant. She says, I feel restless often and I have sleep. How to avoid this? And also, there's a query how to deal with the COVID anxiety that is going around, how to stay mentally sane.
I couldn't get the first question, the voice was not good.
Okay. The first question was, I feel restless often. How to avoid it? I also have sleepless nights.
Then talk to your doctor about it. There can be some reason. Are you mentally stressed? Is COVID taking a toll on you? Is there someone in family that you're troubled with? Or, are you mentally feeling down. If that is the case, you need to talk to your doctor. And the second question was,
The question was how to deal with COVID anxiety.
that's so common even with normal female. I'm so sure that a pregnant female is so worried during these times, because this is the most hardest time anybody can face. Even us, we are in a state of depression, because we are in the house, restricted, can't move. And imagine a pregnant woman going through the same state. She has a baby inside, but she's seeing all these things around. So it's a hard time. So the only thing I can recommend is have some good friends, talk to your family, and talk more positive rather than the negatives, because this time shall pass through. Don't worry. And I'm sure there will be ways out. We need to just hope for the better and keep ourselves positive.
Thank you so much, ma'am. Ma'am, Himanshi is 9 weeks pregnant. She says, I feel dizziness and nowadays I feel hungry all the time. Is it normal?
So giddiness is very common in the first trimester of pregnancy. Talk to your doctor, and I think they will prescribe you doxinate or a medicine that helps you get off giddiness and nausea and vomiting of pregnancy, that you should start taking on regular basis. And regarding hungry,
Okay.
why, if you are sick, why don't you eat? There is no harm. If you want to eat, eat.
Thank you, ma'am. Ma'am, Radha is 12 weeks pregnant. Can I take beetroot and carrot juice daily in the morning?
Of course you can. You can. Definitely you can.
Okay. Ma'am, Roshni has a question. Like we discussed morning sickness, and for the first 3 months, you feel like that. So she's in the third month. So she feels one day she is burping all day and nausea
And the
and
other day
all
she's
that.
fine.
And the other day she's fine. So she wants to know if this pattern is normal.
This pattern is pretty okay, because now it's a waning of phase of morning sickness, because you are already in your 13th week, I suppose. So definitely it's a waning of phenomena. And gradually, in I think next 3-4 weeks, it will wane off totally, I'm sure. So don't worry.
Thank you, ma'am. Ma'am, Navina says, I've gone through cervical stitches.
Yeah.
What precautions should be taken?
So abstinence is recommended. Second, avoid any heavyweight lifting. Don't do something by moving down. And don't put undue pressure or strenuous exercise while being pregnant. These are the basic precautions that you're supposed to take.
Thank you, ma'am. Ma'am, Vinny is 8 weeks pregnant and having a fibroid in the fundal region. Are there any specific food items to avoid for this?
Not really. Food not related to the fibroid size or anything like that. But keep a track on the baby as well as the size of the fibroid, because in pregnancy, the size of the fibroid increases. It might cause you preterm pains. So you have to talk to your doctor, get yourself regularly checked, and get ultrasounds done.
Thank you, ma'am. Ma'am, Charu
Good
is
questions.
asking.
Apart from pregnancy, I'm getting a lot of questions which are not related to diet in pregnancy.
Yes, so we get a variety of queries that day to day they are facing.
Yeah.
Coming back to a diet related question, Charu is asking, how can blood pressure be controlled with food? I have minimized salt intake. I'm having high BP and I'm towards the end of first trimester.
I would like to talk to her, because it has to be dealt in properly. So, what we say is any hypertension we diagnose pre-eclampsia after 20 weeks of pregnancy. So, if she is just in the first trimester, maybe we need to monitor her blood pressure. And as per dietary requirements, definitely the intake of salt to be reduced. That's the only thing that I can say right now. But her blood pressure should be monitored regularly, and also her ultrasound should be checked for the how's the baby and everything.
Charu, I hope you are monitoring it regularly and in touch with your doctor. Uh, Pooja has a question here, very interesting. So Pooja is asking, I'm in my 25th week. Is coconut water safe to drink in the third trimester? I've heard it is not recommended in the third trimester because baby's head might be affected due to coconut water. Is it a myth or just, or there is there any science backup for this?
Totally a myth. Coconut water is very safe in all trimesters of pregnancy. The only thing is it's very expensive now.
True. Ma'am, Garima is saying, is it fine to take protein powder and casein powder if I have high glucose level?
So there are sugar-free protein powders as well, like Be Light and all. So you can take those type of protein powders, which are
Okay. Ma'am, Navi is asking, my baby weight is 1167 grams at 28 weeks. Is it normal weight or is it low? What should I eat to increase baby's weight?
so it depends on how your weight is, how your physique is, how your body built is. It depends on that as well. But at 28 weeks, a weight of 1.5 is okay, though on a lesser percentile. But I cannot say much until I don't know the history of the patient.
Thank you, ma'am. Ma'am, Tripti is asking, what should be our first meal of the day?
The first meal of the day, as soon as you get up. So
Yes.
it depends, like if you are in your first trimester, I told you, like, a carbohydrate rich meal should be there as soon as you get up to avoid the morning sickness. But in general, as regular people do, a normal nice healthy breakfast, which can include a glass of milk or a smoothie, some fruits, and anything which is made at home, paratha, sandwiches, quinoa, upma, dalia, whatever she likes, should be the first meal.
Thank you, ma'am. Amrit is asking, I'm in my seventh month. I feel pain on the left side sometimes in the upper and sometimes in the lower abdomen. Is it because of acidity or is it because of something else? Whenever I sleep on the left side for a long time, it pains more.
Yeah, so second trimester, the ligament pain is very common. So there is stretching of the ligaments on either side of the uterus, and that can be a good cause of pain that you have, which is not constant but off and on. Maybe when you take a curvet on the either side, you might have a stretching pain. So that's pretty common.
Thank you,
I
ma'am.
don't think
Ma'am,
it's for acidity.
okay. Ma'am, Varsha is asking, I'm 28th week pregnant and my amniotic fluid is 9 centimeter. What to do to increase the fluid?
So take plenty of fluids. Your doctor must have advised some tablets to increase the fluid.
Okay. I think
And good hydration is very important.
thank you, ma'am. Ma'am, somebody says I'm in my 19th week and my anomaly scan says my uterine artery Doppler is increased. The mean PI value is 1.59. Is there any diet that can help me?
Again, diet doesn't have any relation to your uterine artery PI.
Thank you, ma'am. Uh, Moving on to the next question here. Uh, Same, Dr. Amrit is asking, 25 weeks pregnant. Nowadays, I don't feel like eating food and don't understand what to have as I feel heartburn. What shall I have? I think ma'am has already recommended probably a cold glass of milk, right, ma'am?
If she's having a lot of acidity, though we do not recommend antacids very commonly, but if she wants to have a plain pantop or an antacid in the morning,
Okay,
and then throughout the day avoid spicy food if possible. Every 2 hours hourly have some small meal, whatever you like, which is homemade, something interesting that you want to make.
okay. Thank you so much, ma'am. Ma'am, Anshita is already in the 22nd week of pregnancy, and now I'm not taking any supplements. Is it necessary to take supplements as tablets?
Definitely. So this is the most common myth that I come across. They don't talk to to their doctor. They don't show them during their first trimester only. As I initially told you, that prenatal vitamins are the most essential part of a normal pregnancy, especially the intake of folic acid. So folic acid prevents neural tube defects. You should start folic acid as soon as the pregnancy is diagnosed. You have to be on iron and calcium because the requirements increase during pregnancy. Since you are in your 22 weeks of pregnancy, you have skipped a good amount of folic acid, iron, and calcium which should have been taken. But it is never the late. Start iron, calcium, and folic acid intake from now onwards. And I'm
Thank
sure
you,
you
ma'am.
must have got your level 2 done, the anomaly scan as well.
Okay. Ma'am, Rufina is asking, can I eat well-ripened papaya? And also, when I smell orange, I vomit. What can I do to supplement for orange?
So you can take nimbu pani with amla. That is okay if you don't like orange. But a good question. So raw papaya has papain, which is supposed to be an abortifacient, and so we generally do not recommend in the first trimester. And so if you want to have ripened papaya, that's fine.
Thank you, ma'am. Ma'am, Tripti has another question for you. Is diet related to baby's brain development?
Diet? Yes, definitely, for sure. That's the reason the diet keeps changing as the trimesters change. So, for the first trimester, as we say, there is a lot of nausea and vomiting. We do not focus on a lot of protein, fat, and rich food. Rather, we tell them that have plenty of fluids and the prenatal vitamin as advised. But in the second trimester, your protein intake has to increase. So whenever a patient comes to me, I always tell them that your protein intake has to increase in the form of paneer or soya or black chana, and the iron requirements increase. So definitely the green leafy vegetables, nuts, as I have told you. So these all affect the brain growth of the baby, and you have to take a nutritious, wholesome food always.
Thank you, ma'am. I think your voice is breaking a little. Some issues with the internet.
I missed it. What happened?
No, ma'am. I think there's a little bit of network issue. So your video is a little.
Now can you hear
Okay.
me?
Hear me now? Yes. Yes. Ma'am, I'm asking you a query from
Yeah.
Achla here. Can you hear me? Yeah. So she's saying this. We've been discussing obesity and how much weight they should be gaining. She's saying she's on the other side. My starting
Can
of
you
the
hear
weight
me?
of the. Yes, I can hear you.
Okay.
Yeah. So
Yes, please
she's
tell me.
saying my weight at the beginning of the pregnancy was 53. So right now she's
Yeah.
in 23 weeks. So she's saying I lost 3 weeks in the first trimester, 3 kgs in the first trimester. My
Yeah.
current weight is 55. It is not increasing, so I'm worried. My current diet includes 2 glass of milk with Nutri-Right protein powder, dry
Yeah.
fruits, and almond, like 4 almonds, one fig, cashew, paneer, apple, pomegranate, banana, and also watermelon. What else can
Yeah.
she do to increase her weight?
Yeah, so first is you don't have to take stress about the weight, because in the first trimester the weight does not increase, or rather you lose weight because you're so nauseous and you have so much of vomiting that the 53 weight will go to 50. You don't have to worry at all. So we do not consider the first trimester weight gain. Yes, second trimester onwards, now since you will resume your normal diet, and as you are telling me whatever you are eating is very healthy, so definitely you will start gaining weight. Apart from the fruits and vegetables that you are telling, of course, take carbohydrates and protein also in your diet. And in due time, you will see that the weight gain is there. So do not worry at all. You are just starting your pregnancy in your 15th week, right? So do not worry.
23rd week, ma'am.
You are in your 23rd week. Still, it's your second trimester going on. You have a long way ahead. In the second trimester, we say 1 kg weight gain per. per month, and in the same way, by the end of the trimester, you will gain weight definitely.
Thank you, ma'am. Ma'am, Rashmi is 33 weeks pregnant. At how many weeks will the head of baby usually fix? And how can I identify by myself that the head is fixed or not?
Is she a first? Is it her first pregnancy, or is she a multigravida? So in a preemie who it's her first pregnancy, then the head engages first. That is by term 37 week. You can say 37 to 40 week is called term pregnancy. So by 37 week you can get to know that it's engaged. Your doctor can only tell you. You cannot understand if it is engaged or not. And in multis it takes time. It engages during the time of labor, so that also the doctor will tell you.
Mhm. Thank you,
Yeah.
ma'am. Ma'am, Jyoti is asking, is there any harmful effect on the baby if mother is COVID positive?
So as far as the data which is available, not much evidence is there that COVID has any harmful effect on the baby, and not enough evidence is there about the rate of miscarriage or abortions also. So not enough data is available that can say that COVID has effect on the baby also. So as of now, you do not have to worry. It is not teratogenic.
Thank you, ma'am. Ma'am, Supriya says, I have borderline gestational diabetes. Can I have juices like beetroot plus carrot and apple in the morning and evening any fruit juice like muskmelon without sugar, honey, or jaggery? Is that safe?
The morning regime, I can understand it's fine. Apple, beetroot, carrot can have. In the evening, muskmelon is little rich in sugar. You can try and avoid muskmelon. Rather, watermelon can be taken, oranges can be taken, kiwi can be taken, and plum or peach, if available, can be taken. Berries can be taken.
Thank you, ma'am. Ma'am, Rita has a question. I'm in the 38th week, and since yesterday I have a little dry cough, and today I have fever 99 to 99.5. I'm trying to contact my doctor on the same, but can you suggest me what I can take at home to get relief from dry cough and fever?
So first you should have a pulse oximeter with you. If you are having fever which is crossing 99.8 and you are having dry cough and other symptoms like loss of smell or loss of taste, then check your SpO2 and then immediately contact your doctor. You can definitely take plain paracetamol presently, and for dry cough, any cough suppressant, but you need to get yourself tested in case the symptoms persist, and you have to talk to your healthcare professional immediately.
Thank you so much, ma'am. I think Gopal has a similar question. So, my wife is 6 weeks pregnant. She's taking coconut water daily. From the last 2 days, she's having body pain, and today she's having fever 100.9. So, the diet is not going to fix this, right, ma'am? I think they should get tested as soon as possible.
Definitely, definitely. Any fever during these times has to be tested. You have to test it, especially in pregnant women.
Thank you so much, ma'am. I think you are getting late. Ma'am has a function to attend right now. I've already kept her longer than I had promised. So, everybody, if we missed your questions, I know I am missed quite a lot.
How many questions did we have, Anusia?
Mm, ma'am, I don't have a count, but then I'm still scrolling. So, there are quite a few. It's okay. So, to everybody whose questions we missed, please post them in the feed section. One of our experts will revert within 24 hours. So, don't worry, we will get them answered. And to Dr. Anushree Pande, thank you so much for joining us, ma'am. Like, I know you have a busy day today and you made time for us. So, thank you very much. The users are thanking on the chat, and we were very, very happy to have you, ma'am.
I hope I could answer them well and they were satisfied.
Oh, definitely, definitely, ma'am. And also to all the users, you can follow the diet on the iMumz app. It is a well balanced diet. Ma'am is constantly telling you it has to be a good nutrient that you are taking throughout the day. So if you are running out of ideas, we have recipes and diets to check out. So do check them out and do follow them. And we will see you in the next session of Ask Me Anything very soon. Thank you, ma'am.
Yeah. Thank you. Bye.
Bye.